Hi. Hello everyone, welcome back to ETimes Lifestyle. I'm Tenzin Chudin and today we'll be joined by Dr. Manan Vora, who is an orthopedic and sports medicine specialist and a sports enthusiast himself. Hi doctor, hi. How are you?
Hi. I'm good. How are you?
I'm fine. Thank you for joining in.
Thank you so much. Thank you so much to ET for inviting me for this. I really appreciate the opportunity and really looking forward to a
Yeah.
good conversation with you.
Yeah, and also today's World Arthritis Day, so it couldn't be
Yes.
a better time, for us to have this interaction. So yeah.
Yes,
Thank
absolutely.
you.
It's a day which orthopedics really remember, and we really have to go out of our way to increase the awareness about orthopedic health, arthritis, and all of that on this day. So it couldn't have been a better day. Absolutely.
Right. So, as I've mentioned in the intro that you're an orthopedic and sports medicine specialist. So, we would like to know more about your journey. Was it something that you always planned on, pursuing, or did it happen gradually? Given your passion for sports.
Yeah, so I've personally, been an athlete all my life. Right from a very early age, I got into sports myself, and I've competed at the national level in lawn tennis, at the state level in cricket and football. So I've constantly, been playing sport and competing at that level.
Right.
From the medical side, I come from a complete medical background. So I have grown up from that sort of background where medical cases and patient histories were discussed on the dining table, very honestly. So that is
Right.
something that it was a surrounding I really grew up in, and I really took a liking to. And when it came to making a decision, I eventually ended up choosing academics. I ended up choosing medicine instead of being an athlete or being a sportsman. But didn't realize that life would pan out this way, that I would find a way to amalgamate my love for sports and
Right.
my profession as an orthopedic surgeon, and find a way to still deal with athletes, sports injuries, and all of that. So I'm still in and around the sports the sports scene. So this is a way I found to really join my love for both of them, which is sports and medicine. So that's where it comes now.
Right. So,
Yeah.
what were the kind of challenges that you faced, during your practice, and also how difficult was it during COVID, especially because you had also spoken against, the violence against doctors.
Yes.
Yeah.
Yeah.
So,
So I think there's been enough instances where people have tried to stand up and raise issues that medical students in India face. In general, the kind of problems that are there, apart from the fact that junior doctors are extremely overworked, they are definitely being underpaid. There is no regulation, there is no system, there is no concept of shifts or hours. It's more of just being overworked and
burnt out.
innumerable hours per week compared to other medical systems across the world. The salaries are extremely low as well, and on top of that, because you brought it up, because it was actually something that I hold very close to heart, to actually raise my voice against violence against doctors, because during COVID it really reached a point. Obviously, see, it was a new situation for everyone was dealing with a new disease, everyone didn't have answers, so everyone was doing their very best. And obviously we understand from the patient's point of view, the relatives' point of view, that they are also concerned, they are also a little worried. They also don't know what is really going on, and they remove their frustration and anger in a particular way, which is not really right. Because how many people today say that they go to work not knowing if they'll get abused or not knowing if they'll get hit? That's not a very normal work environment to have. That's not the way anyone should be living. Forget, I'm not even talking for doctors here. No one should have to be like, aaj main kaam pe jaunga and I don't know if someone will abuse me, I don't know if someone will hit me, I don't know what can happen to me. So it was obviously a huge challenge that everyone was facing, and I was very happy to contribute in my own little way by trying to at least use this platform that I had. Of course, back then it was a much smaller platform, but at least try and raise my voice against it. It ended up reaching a Bollywood actor who ended up having a conversation with me, and we got covered in a lot of newspapers. So at least that sort of awareness was created. But it's not like these issues have stopped today. These challenges and these issues are there very much even today, and it's something that is an ongoing battle that is going to continue. But from our point of view, at least the least we can do is tell people that it's not okay to be doing this, to try and hope that there are rules and systems in place, punishment is given to those who are doing it, so that there is an example set, so the next person actually fears it, ki, shit, this is what happened to that guy who did it, I shouldn't be doing it myself. So yeah, these are some of the challenges and issues that are there, but I mean they're on an ongoing basis. It's something that we have learned to deal with. We have not accepted, but we are learning to deal with and trying to go about our lives and do our work, because that's ultimately what we genuinely want to do.
Also, doctor, so I personally think what is great about you is the fact that it's you're not just telling patients what to do, what not to do, but also you practice what you preach. I'm guessing, because considering you have a sports background and you understand, you have a practical knowledge of how injuries, recovery work. So in terms of orthopedic health, what are the top 3 things you would like to recommend to people or athletes, for that matter?
So, I always like to say that each one of us has an athlete in us. It's not about only catering to the elite athletes or the professionals who are playing sport or who are using fitness as a means towards their profession. At the end of the day, each one over here should be aiming to be a healthier, fitter version of themselves tomorrow than they are today. So ultimately the human body is the same. So whatever we preach, whatever we talk about actually applies to everyone. It's not just, to the athlete. When it comes to orthopedic health, you can broadly classify issues into 2. One which happens due to acute injuries, due to freak accidents, due to injuries while playing sport or doing something in the gym or any sort of accident, fall and things like that. And the second are which happen due to chronic issues. They are either due to overuse injuries, due to repeated small damage happening to the muscles, tendons, ligaments over time, or they are degenerative conditions like your arthritis and your slip discs and all of that. So when it comes to that category, the degenerative category, what we can do is ensure that we're moving our bodies. That's the first thing. Please exercise, please try and lift weights as much as possible. I know there are many people who don't enjoy weightlifting. They enjoy different kinds of physical activity, and it's okay to start and pick up something that you really like doing. There's nothing wrong in that. Even that's better than not doing anything. But at the end of the day, if you can provide some sort of resistance to your training in terms of weights, that really helps improve your muscle and joint health. It really helps reduce the rate at which your bone density decreases. So after the age of 30, our bone density slowly starts gradually falling. So to reduce that rate of bone density decrease, if you're lifting weights, if you're strength training, if you're maintaining an ideal body weight, you're definitely in a much better boat. So lift weights, try and reduce the rate at which your bone density will fall. So exercise, lifting weights, that's the first thing. Secondly, a lot of problems come with being overweight and being obese. Now, a lot of people think that obesity means, those extremely large people, but you'll be surprised to know that if you are 20% above your ideal body weight, you are considered obese. You may not look absolutely obese, but you still fall under the classification of obesity. If you are 10% more than your ideal body weight, you are overweight. So it's as simple as saying, if you are supposed to be 60 kgs and you are 66, you may not look that different at 66 compared to 60, but that does mean, yes, you are overweight. If you are 72, 6 kgs more, that means you are obese. Even though in your mind, you're thinking 120 kg wala obese hota hai, 72 wala nahi. It's about the percentage based on your ideal body weight. So obesity comes with its entire list of problems that really lead to a lot of orthopedic issues. So maintaining an ideal body weight is extremely important. It is easier said than done, I know that, but that is where nutrition plays a large role. I've spoken about exercise, but that's where we move into nutrition, because being in a calorie deficit, having portion controlled meals, ensuring that you are not completely in a calorie surplus, unless that is a separate fitness program you're on in terms of gaining. But otherwise, with most people generally need to cut down, you need to be in a calorie deficit and consume the amount of protein that you're supposed to consume. So when you do all of these things, you are taking steps towards maintaining an ideal body weight. You are ensuring you are not overweight, you are ensuring you are not obese, and that will go a long way in helping your orthopedic health as well. And the last thing I want to talk about, since we've covered exercise, we've covered body weight, we've covered nutrition, the last thing is avoiding smoking. Smoking has everyone knows how bad smoking is for your lungs, but smoking has a lot of negatives for your musculoskeletal system as well, for your bone and joint health as well. So that is the fourth and the last point I'd like to mention, is avoiding smoking.
So as you spoke about nutrition, how much are you for supplements is what I wanted to ask next.
I am in fact a big advocate of supplements whose science I understand and the ones I genuinely believe should be taken based on my knowledge. So I really like to tell people that please embrace supplements. Now, there's two things you need to understand. One is that there is nothing wrong or artificial in supplements. They have been created for you to help you reach your daily required goals of a particular substance that you want to take. That's the first thing. And the second thing is, when a lot of people mix the term supplement with substitute, that is where they start making mistakes. Supplements are not your substitutes to what you have to consume in your diet. They are supplements, means they are add-ons. They are there to help you out and help you reach, let's say, your protein goals, your vitamin goals, whatever goals, when you are unable to reach it with your natural diet due to some reason or the other. And there could be a variety of reasons. There could be a variety of reasons. If I'm a vegetarian, not even an vegetarian, if I have to consume 1.5 grams per kg body weight of protein per day, which means if I am 70 kgs, I have to consume 105 grams of protein a day. Now, if I cannot eat egg and I cannot eat fish and chicken, which is the case with a lot of people in India, it's very difficult to reach 105 grams of protein and meet my protein goals. How much dal, pulses, soya, how much can I keep eating that? There's only so many hours in a day, there's only so many meals in a day, and you'll obviously be consuming carbs and fats as well. There is absolutely nothing wrong in embracing a good whey protein supplement in that case. So I am very much an advocate for supplements. However, I do understand that supplement is a multi-million dollar industry across the world, maybe billion-dollar industry across the world. And whenever there is something good, there is always the other side of the coin also. There are certain supplements, I don't want to go and name them and disrepute any supplement, but what I want to say is that they are unnecessary. I won't say that they harm your body or make such big statements, but they may be unnecessary for you. So when it comes to that, I stay away from those myself. I do not recommend or refer those to my patients or to followers on social media, for example. But otherwise, for supplements that are otherwise really making sense and helping me, I'm a big advocate for it. Yes.
Okay. So also something I wanted to discuss was the prevalence of heart attack in younger population these days, and probably it's the unhealthy lifestyle adding being a big risk factor. But also experts have said that over exercising and overstraining the body could also be one of the factors leading to such instances. So could you how much do you think is true, and could you reflect on it?
So, we have seen certain cases, and even when you're following sports, you see a sudden acute cardiac arrest in an athlete who is otherwise fit and otherwise doing okay. It's very difficult to, pinpoint and find the exact reason. Yes, of course, tests are done, and most times these guys end up having, some sort of congenital heart problem that was not diagnosed, or they have some structural heart disease that was there, and it has in some way really caused an impact while they were overexerting. But for the general population who doesn't undergo so many tests, doesn't undergo an entire cardiovascular health evaluation, it's very tough to actually tell or really predict what can happen to someone on what they should actually do to avoid it. It is more of a case of fate rather than something you can actually avoid. Yes, there are certain risk factors. Now, for example, I know you've asked me related to overexertion during exercise, but we also see a lot of heart disease and sudden heart attacks in the younger population in general, not while they are exercising as well. So, that's where lifestyle related things coming, your diet, your cholesterol levels, your lipid profile, what exactly the amount of your HDL levels, your LDL levels in your blood, your smoking, your obesity, the kind of diet you consume, your stress levels. Stress is something we don't really give enough importance to, but your mental health and the amount of stress you're undergoing, either financial, either while working, either relationship related, all of these factors can really increase the chances of having a sudden cardiac arrest. So these are all factors that can increase it. Overexertion per se is something that cannot really be predicted. However, it is advised that you should have a gradual build up in your exercise activity. So obviously, if you are, let's say you are used to just exercising for 20 minutes a day, and you suddenly went for an intense football game where you're playing for 90 minutes non-stop, obviously your body is not ready for it, and that's where something can happen. But otherwise, things can happen at any point, and it's obviously very difficult to predict. What we can do from our end is to try and reduce the risk factors. How will you reduce the risk factors? You will gradually build up your exercise and exercise threshold, so that your body's capacity to withhold vigorous exercise increases. You try and maintain an ideal body weight. You watch what you eat to ensure your lipid profile and your cholesterol levels are all normal, and you don't smoke. Very, very important. You try and meditate. You try and seek mental health help if you need, and ensure you're not stressed. So these are all the factors that we can keep in mind. However, there's no direct correlation to say that ये अगर आपने किया तो you will not have a heart attack. It can still happen to anyone.
Right. So my next question is on behalf of all the people, with desk jobs, who are working professionals. But in general, backache, stiff neck, these are kind of common ailments that we often experience. So what do you have to say, what do you want to recommend to people, like how to correct posture, or, how to overcome these problems?
No, absolutely. Especially since the pandemic, the entire work from home situation has happened, and the number of patients we have seen having neck problems, mid back problems, lower back problems, even hand and finger and wrist related problems, because everyone's screen time has increased. Everyone is spending more time with their laptops or texting on the phone. These are all occupation related issues that have really surfaced right now. It's very easy for me to say go correct your posture, but correcting your posture is a very, very big deal to actually do that. Now, the few things that you need to keep in mind is that when you are sitting at your desk and you are working, there's obviously a lot of emphasis on ensuring your back is straight, ensuring your computer is at the level of your eye, so that you're not flexing your neck and bending. All of these things are all great on paper, and very honestly I recommend them as well. But the one thing that I will say is far more important than your entire ergonomics, the way you sit on the desk, the kind of chair you have, the kind of table you have, what height the laptop is at, what height your vision is at, is just get up every 20 to 30 minutes. Just get up, go for a walk, stretch a little and come back. Again, it's very easy to say that in an 8-hour day you're telling someone every 30 minutes to get up. How is someone going to do that when they're in that working zone, when they're in that? And I completely understand, but then again, nothing in life is easy as well. So I feel if you just have an alarm on your phone, and this is something that I really recommend, is if you have an alarm on your phone for every 30 minutes, and after 30 minutes it rings, and you do a couple of things. Number one, you get up from your chair and just take one circle and you come back. What this does is it not only really works your spinal and cervical muscles. That's the first thing. 2, you'll be stretching your legs automatically because you're sitting with your knees flexed, so they'll be extended and you'll be taking a walk. 3, you'll be really helping your eyes get a little break away from the screen. Even if it's just 1.5 minutes, you'll really help your eyes get that little bit of break. You'll really help your fingers, which are constantly in this position or this position, you'll allow them to be extended and stretched, and you can do this as well. And very importantly, you can also include a glass of water in this routine, so that you ensure you're meeting your water goals, which is not related to this topic, but I just like to do it because it kind of works beautifully in that 1 minute. So just get up, stretch your neck, stretch your hands, stretch your back, stretch your neck, give your eyes a break and drink a glass of water, get back to work in 1.5 minutes. It just becomes a habit. And if you drink 1 glass of water every 30 minutes, you're anyway hitting your water goals as well. So that's working for your favor as well. So I like to keep things simple and tell people that just try and do this much instead of me saying, oh, do exercise 1, 2, 3, 4, 5, 6, 7 and we'll figure out your posture correction. That's a completely separate thing. So this is something that they can incorporate. And the other thing is, instead of focusing so much on posture correction, which has now become such a term, my DMs are full of people saying how to correct posture. And I'm just thinking that unless you have a severe postural deformity or a diagnosed muscular imbalance, I don't think you need to go into an entire posture correction plan or physiotherapy sessions, which we recommend for people for posture correction, which is great and it works, but you may not really need it. Instead, just focus on moving that damn body. So if you go to the gym thrice a week or 4 times a week and you hit your back workouts and your chest workouts and your core workouts, automatically you'll be engaging all those muscles and you'll be ensuring that they come and improve your posture over time themselves. You don't really need going for something specific related to posture. So again, my advice goes back to just move your body, just ensure you're at an ideal body weight, just ensure you're hitting the gym 3 to 4 times a week. So it's just amazing how all of it eventually comes down to that. So those are the few tips that I just like everyone who's spending a lot of time in front of the screens to actually do. It's actually contradictory that I'm giving this advice because it reduces my business, but I'm just being nice now. So just kidding.
But it's some great advice and very relatable as well.
Yeah. So I like to keep things simple and say just get up every 30 minutes, hit the gym twice a week. It's as simple as that. You don't require a 10-step posture correction plan unless there is a completely separate diagnosed issue, which is obviously different.
So also lastly, what I wanted to ask was orthopedic health is something that we often tend to ignore, because it kind of comes at last, somewhere, when it comes to prioritizing it.
Absolutely.
Yeah, only when we have some muscle pull or pain or some, joint stiffness, then is the time that we remember and go visit a doctor or something. So could you, reflect on some common, uncommon orthopedic disorders, that we need to be mindful about? Because recently even I had some issues around my jaw and so I got to know about TMJ and all these problems, because I researched a little bit. So could you reflect on that?
So just to tell you firstly, TMJ is actually not orthopedic related. We have
orthodontist.
Orthodontist, maxillofacial surgeons which look into TMJ. But I get your point, because in the list of problems, when you have so many things to do during the day, and a little knee pain here and there, a little back pain, a little shoulder pain is something that people don't really take that much into consideration and importance, and they don't really rush to their orthopedic or to their general doctor for such things. Again, I don't see something very wrong with that, because in today's day and age and in today's lifestyle, there are minor aches and pains which are very common and which will occur to you, and it would be wrong of me to propagate and say that come to me immediately when this happens, because that may just settle over 24 to 48 hours. What I talk about is certain things that you need to keep in mind to really remember that if this is happening to you, you need to visit an orthopedic. So one thing is, any sort of swelling or inflammation of a joint that doesn't settle in 48 hours, it should be visited. Of course, this I'm talking of is of a natural swelling. I'm not talking of if you've fallen down and your ankle is swollen and you don't have to wait for 48 hours, because then you could have had a fracture. That is trauma related. But any other swelling due to any other reason, 48 to 72 hours, you should definitely come. There is something what we call as ROM, which is range of motion of a particular joint. So if this is my elbow, this is my elbow's range of motion. So if your range of motion of any joint, your wrist, your fingers, your elbow, your shoulder, your hip, your knee, your ankle is restricted due to any particular thing, you are not able to move it due to any particular reason, definitely it's a big red flag and you definitely need to visit an orthopedic. Apart from that, any pain or pinpoint tenderness lasting for again a day or two or over 2 days, you should obviously get it checked. Apart from that, there are nerve related problems. If you have because back pain is associated with a lot of tingling, numbness running down your legs, sciatic pains, any sort of any sort of you lose some sort of feeling in your toes. If any of that is happening, again, that's a very big red flag and you need to come and get checked. So these are a few things you need to obviously keep in mind, and if they are if you are facing them, then it's time to see an orthopedic. But minor pains and aches is obviously something that in today's lifestyle is going to happen to everyone.
Okay. So that was about it, but I would like to sign off with you talking about arthritis and giving some tips around it. Yeah.
Absolutely. So arthritis refers to obviously any pain or swelling or inflammation of one or more joints in the body. Now actually when we talk of arthritis, there's a lot of conditions that come in arthritis, but at least the two main which we like to create awareness about, at least on this day, is osteoarthritis, which occurs due to a degenerative disease and wear and tear of the joint over a certain period of years. And then you have rheumatoid arthritis, which is an inflammatory disease or an autoimmune disease which occurs in one or more joints. So these are the two main types of arthritis. Most importantly, again, we'll go back to the same points again and again because they are that important. Is no smoking, obesity. These are the very important ones that can really precipitate. So maintaining an ideal body weight, exercising, focusing on your nutrition, ensuring you don't smoke, all of this will reduce the risk factors. Yes, there is a slight genetic component for these diseases, but that does not make these diseases as what we call as inheritable diseases at all. So does not mean if someone in your family has them, it does not mean you will have them. What you need to do is ensure you are taking all the right steps to maintain your orthopedic joint muscle health today, so that you don't face these problems at some point in your life. So I may sound a little repetitive, but my advice actually remains the same, even for arthritis related things. Again, if you have any pain, swelling, stiffness, restricted range of motion, pain in one or more joints, these are all red flags for arthritis. Please go to your orthopedic, please get checked. At least with rheumatoid arthritis, it's good to get diagnosed as early as possible. So if you have pain and inflammation on one or more joints, especially joints of the hands, wrist, these are the common sites of rheumatoid problems. You need to go get checked and diagnosed because you may need to be put on some sort of long-term medication. So these are a few things to keep in mind for arthritis. Yes.
Right. Thank you so much, Dr. Manan. It was great chatting with you, and thank you for joining us again.
Yeah. Thank you so much for having me. Thank you. See you.
Yeah. Bye-bye.
Bye. See you.